One of the things that we do to handle that is like being sort of humble about what the AI can actually do. Um, that's why we focus on systems that are more about assisting people instead of just doing things in fully automated fashion. Because then you can take something that's maybe not entirely, 100% accurate, and yet it can still make people much more productive. It can still ensure that patients, are getting better healthcare faster, but not inadvertently harm them because there's still a human that's, checking that things are being done correctly. I think in the short run, the main thing it does is just increases the productivity of clinicians. That's particularly looking at things like NLP. That's what we're going to see. Because again, there's limits to what the AI can do on its own. So it's much easier to make those assistive technologies. So the main thing that I personally would like to see is like clinicians be able to focus more during their visits, not have to like drive the EHR as much. So you can see how that starts to come. If you can understand more about what's already in somebody's past, like medical history, then you can probably give them better information quicker. And then also just generally reduce the sort of documentation burden overall. So hopefully for the patient, that means, again, happier, more focused clinicians that can really help them.